Welcome to our monthly self-directed services webinar, in which we review important topics to help you successfully self-direct your services. Please note this webinar is being recorded and it will be posted to our website along with a copy of the presentation on our forms and resources page under webinars. I'm Peter Cook, Director of Stakeholder Relations, and I'm here with Anira Fox, our Accounts Payable Manager, Kevin Raynor, our Assistant Accounts Payable Manager, and Mark Weinstein, our Senior Director of Self-Directed Services. And today we are going to be reviewing vendor and invoice requirements. So we do have a Q&A module available on Zoom for those that have questions. If you would kindly wait until the end of the presentation to ask questions, we will have an answer session at the end. So to get started, we're reviewing vendor and invoice requirements. Please note that we won't be going over submissions for mileage or health reimbursements today. And all documents referred to in this presentation can be found on the forms and resources page of the website under Accounts Payable. As of January 1st, 2025, we have updated our vendor and invoice requirements to align with the Developmental Disabilities Administration's Self-Directed Services Manual. So one major change you'll notice is that we have a new FMS vendor compliance at the arcccr.org email. In addition to the FMS vendor at the arcccr.org email. So just to be clear, you would still submit your invoice and your vendor payment request form. One or the other should be signed by the participant when you're requesting payment. But any compliance document that would support the payment would now be submitted to FMS vendor compliance at the arcccr.org. So these new compliance documents are applicable to all the different services. Over this next slide, we're going to review requirements that are applicable to all services, no matter what kind of vendor it is. So no matter what service is being provided, whether it's personal supports enhanced, community development services, ongoing job supports, respite, support broker, or other, we require this documentation from the vendor. So for the ARC to pay or reimburse for goods and services provided by a vendor, a Form W-9 must be provided for the vendor. In addition, the following items must be submitted for all employees of the vendor who are providing that service. So that would be a photo ID showing the age of the employee, showing that they're 18, or in the case of respite, 16, CPR and first aid certification, criminal background check, and if the participant is under 18, a CPS background check as well. All documents provided must be current, which is to say that they can't be expired, and they need to be current during the date of service that's being submitted on the invoice. Identification must reflect the vendor employee's current name, address, and other relevant identifying information. Photo IDs must be state or federally issued, such as a driver's license or a passport. And CPR and first aid training certifications may be fully in-person or a hybrid blended learning training that includes an in-person skills component for both CPR and first aid. There are certain services that can only be provided by a DDA-approved provider. This includes dehabilitation, for which an OHCQ license is also required, behavioral support services, employment services other than on-the-job supports and follow-along supports, family and peer mentoring, family caregiver training and empowerment, housing support services, supported living, and respite licensed site. Now we're going to review additional requirements by service. So far, we've gone over the requirements that apply to all vendors, regardless of service. For nursing support services, in addition to what we already reviewed, the employee of the vendor providing services must have a nursing license. I would note here that in the case of nursing support services, there is an exception to the CPR and first aid. A nurse would not need to provide the CPR and first aid as long as they provided their nursing license. For support broker services, the employee of the vendor providing services must be on DDA's list of certified Maryland support brokers. And the support broker employee providing the services must be specifically listed on the participant agreement for each participant. For transportation, the employee of the vendor providing services must have a driver's license, and the vendor must have auto insurance for the vehicle. Commercial providers such as Uber, Lyft, and Mobility are not required to submit driver's license or auto insurance. For orientation, mobility, and travel training specialists, the employee providing services must have a travel trainer certification from one of the following. For environmental assessments, the person doing the assessment must be licensed by the Maryland Board of Occupational Therapy Practice as a licensed occupational therapist in Maryland, or they must contract with a vendor approved by the Division of Rehabilitation Services, commonly referred to as DOORS. For environmental modifications, the vendor or employee of the vendor providing services must be a licensed home contractor or DOORS approved vendor, have a home improvement license for projects where an existing home structure is modified, such as a stair glide, be properly licensed or certified by the state, be in good standing with the Department of Assessments and Taxation to provide the service, obtain and maintain commercial general liability insurance, obtain and maintain workers' compensation insurance sufficient to cover all employees if required by law, and be bonded as is legally required. For respite camp services, the vendor providing the service must be a DDA-approved camp. This list can be found on the American Camp Association's website. Next, we will review vendor invoice requirements. A vendor payment request form is recommended, though not required, and it can be found again on the AP section of the Forms and Resources page of our website. Invoices must contain all necessary information included in the DDA's Self-Directed Services Manual. While it is not a requirement, the ARC recommends including a vendor payment request form with your invoice submission. The vendor payment request form is a convenient place to include required information when submitting an invoice, including the participant's signature. Please ensure the information on the form and invoices match. An invoice or quote must be submitted with the following: the vendor's name, address, and email, the employer's name as the recipient, the goods or services to be purchased, the vendor name, the services rendered as authorized in the person-centered plan, the dates the service were rendered, start and end times of the services each day, the number of hours and units for each day broken down by the quarter hour, the name of each employee who provided the service, a description of the task completed by the vendor for each time entry, and the total amount charged. Next, we will review some best practices for invoice submission. Please refer to the ARC's accounts payable calendar for invoice due dates and payment dates. Invoices should be submitted promptly for payment. Invoices for service older than 11 months cannot be processed. Please do not email the vendor or compliance inboxes with inquiries about the status of an invoice payment. They are strictly for receipt of invoices and compliance materials. For initial submissions, invoices and compliance materials cannot be submitted through the ticketing system. So when you're submitting, your invoice or VPR for payment, or if you're submitting the compliance materials, those should go to the processing emails that we mentioned at the beginning of the webinar. If you are inquiring about the status of an invoice or the status of some compliance materials, that's when you would want to place a customer service ticket, and you will get a response within a couple business days, usually day of. Um, I would just note that we also shouldn't submit an invoice through the ticketing system if it's never been submitted to the processing email to start with. If you do submit through the ticketing system, you'll just get a response that it needs to be sent to the proper processing email. One thing that vendors can do when you've submitted your invoice in BPR is that they can check bill.com to see the status of their payment. So if you're a participant and you're working with the vendor will receive access to bill.com to view the status of their invoice. On that note, we would just note that vendors must manage the latest direct deposit and address information that they keep in bill.com. That's information that the vendor would update. So I think if you're working with the vendor, it's important to remind them about bill.com. So now that we've finished the presentation, we're going to open it up to questions. Mark is going to read a question, and then Nir and I will provide an answer.
Yeah, thanks. Okay, so I have a few questions. First one is there any way the FMS vendor can get in contact with participants once the vendor is paid? I find out from vendors that they didn't get paid and have to send in tickets to Zendesk.
I think if you want to inquire as to whether or not a vendor got paid, you would just want to check with them. They'll either receive the payment or they could check bill.com to see that the payment has at least been cut. If they receive a check, they can see that the invoice has been processed and that the check is on its way. If they receive an e-payment, that should be, within a 1 to 2 business days.
Next one, I have a participant vendoring CDS with the ARC. When the team asks for compliance documents, the ARC responds that OHCQ license was not needed since the FMS is the ARC. I would prefer the participant have all required documents due to that conflict. How can the participant obtain all the documents? I would answer that to say that the only service that we need OHCQ licensure for is DAHAB, not for CDS. So it's not really because the ARC is providing the service. It's just that we don't need it for CDS no matter who the provider is. Next one, why isn't there a separate form for reimbursement and a separate email? I've had issues with the reimbursement because the ARC wants documents / information for a vendor.
Mark or Nira, do you have an answer for that one?
I'm not sure what it means, separate form for reimbursement, a separate email. As far as issues with reimbursement, the ARC wants documents information for the vendor. Hopefully we're just asking for the requirements that Peter just went over. If that's not the case, and submit a ticket and specifically for what's being asked, we can take a look at it. On your vendor requirements document, it states that respite camp can be provided by a non-DDA approved vendor. I believe I heard you say during the webinar that the respite camp must be a DDA approved provider. So what that means is that that list that Peter referred to, those are all camps that can, as long as the camp is in that list, it's DDA approved and can be used. It's not a DDA provider, it's approved by DDA. I think sometimes we get the wording kind of mixed up there, so we apologize if that's the case. If it's on that list, then you're good to go. Bill.com does not show the invoice being paid. Guess that's a statement. Peter, do you have a response for that?
I would say that if the invoice is not in bill.com, then I would assume that it wasn't processed. It kind of depends on when it was submitted, but if an invoice is rejected because we're missing compliance materials or we're missing, the information that we need on the invoice or the VPR, then the processing email would send a response to whoever it was that submitted it. So I would recommend checking to see if a response was received from the processing email saying that maybe additional materials or information was required. If you didn't get it, I would just recommend placing a customer service ticket.
You plan to maintain a vendor compliance portfolio for agencies with multiple staff members working under a single vendor. This would help ensure that the vendor is aware of which staff member files the ARC has on record, reducing miscommunication, and in turn make sure that payment is made on time. Yes, we have for our records, we have the list of vendors and each employee that's providing a service and the required documents. And if you just need to send it in one time, and we should just be asking for it one time and then making sure we have it in our system. Can we get a copy of this presentation? It will be put on their website soon after we are finished here. Do the vendor requirements cover day-to-day administration vendor invoices? Yes,
Yes.
but there are very few what's required for them.
In that case, I think it would just be the basics, like the W-9 would be required.
Yeah, and then
our
proof of
first
need.
aid, background
Yeah.
check.
Yep. Somebody says spending report will tell when vendors are being paid. Are these compliance things for new vendors or old as far as submitting background checks? They're for everybody. So if we have your background check from before, you should be good to go.
Oh, and Mark, can I chime in on that last
Yeah,
sort
for
of
sure.
question / statement
Yeah.
that you made? And thank you to whoever mentioned that. Yes, I should have mentioned that the participant does have the option of going to the participant dashboard and reviewing the spending report, and that will list a breakdown of expenses that are posted to whatever vendor line. And then in addition to that, there actually is an invoices tab in the participant dashboard that should be an up-to-date list of invoices that have been processed through FMSE. So thank you to whoever added that note.
Yep. A couple questions around IFDGS reimbursement. Is there anything special that has to be submitted for dental? And then for other things like horseback riding, gym, do those have to comply with background check CPR requirements? Peter, you want to mention anything about that? IFDGS.
Does Nir or Kevin want to jump in there?
Yes, I would say no. So IFDGS are typically items that get reimbursed.
Right.
So as long as the vendor provides us a valid social security number or W-9, and it's been approved on the IFDGS spreadsheet, that's usually all that we need.
Which is to say the DDA, IFTGS approval.
Yes, right.
When a CCS has changed, the FMS can see this updated in LTSS. However, what system or process does the ARC use to ensure that vendors are removed from a participant's file when services are terminated? It appears that FMS participants is not always notified. And even when they are, it seems that the information is not consistently communicated across all departments. So I think this is about making sure that we are not paying vendors for a particular participant. I think we are looking at creating a termination process, so it's clear what a vendor is not connected to a participant. More on that coming up, unless anybody else has anything else to add to that.
I would just add that, in this case, they haven't been like onboarded as an employee through the ARC. So, if you're not receiving services from a vendor anymore, then you just the invoices wouldn't be submitted to us anymore. An invoice should be, signed by the participant, in order to be approved. And if you were no longer using a vendor, then we wouldn't process an invoice that wasn't signed by the participant.
IDs and CPR certifications for employees providing services, are they submitted with every invoice, or does the ARC need them, keep them on file? Once we have it, we have it. We don't need it for every invoice submitted.
Mm-hmm. And I'll just add, Mark, you should get an email from our vendor compliance team once those documents have been received. Just confirming that we did receive your requirement.
If a vendor, including support brokerage, does each employee of that vendor need to be listed on the participant agreement? The support broker does, but not all the other vendors.
I think the question, though, is asking if the employees of that particular support broker vendor, if it's, for example, a company, need to be listed. And if
Yes.
that's the case, then yes.
Or the support broker.
Yes, correct. Each support broker working with that participant would need to be listed.
Yeah, if it's a service other than support brokers, the employees need to be listed on the vendor request form or on the invoice. Most likely the invoice is fine.
Yes.
Since a VPR is recommended but not required, can invoices just be sent with signatures of the vendor and participant and still be paid? What I would say, and you guys can chime in, is all required pieces of information can be on the VPR or invoice. Doesn't really matter where they are, it's as long as we have all that information that's required. Because everything else to say about that.
I would just note that we do always need an invoice though. So like we wouldn't necessarily need to receive a VPR, but we always need an invoice. But you could submit an invoice with all the required information and the participant signature, and that can be processed without the VPR form.
Yep. I see a clarification about the CDS question. It was Dahab. That is, if they're telling you we don't need an OHCQ license for that, I don't think that's correct. We would still need that, but actually, I think why they're saying is because we probably already have it. We have our own OHCQ license for the ARC, so that's why we don't need it. So you're good there. My daughter CDS has agreed to also serve as, I guess, a day-to-day administrator. The ARC has on file ID, background check, etc. Do these need to be resubmitted or only the W-9? They are completed background check, so I don't have that on file. So, Anir and Kevin, if we have the documents for the person, we have them, right? Even if they are providing a different service?
Yes,
Okay. So once you submit it for all services, you're good.
exactly.
Yes, but as a best practice, I would say make sure you have those documents together and you can submit them to the FMS vendor compliance email. There's no harm in doing that.
Yeah, but once we have them on file, though, we should have them.
Yes, correct.
Why do submitted requests for vendor payments for services that are approved in the individual's budget and align with their goals get denied without complete explanation? Is there an appeal process? So, Anir and Kevin, when we are reviewing requests and they get denied, we send them an explanation as to why, correct?
Yes, you should be getting communication that this was in alignment with NIGDS requests. Was that
No,
question, Mark?
it doesn't say specifically, but just a request for vendor payment for services.
Yes, the communication, it should be very detailed. And the communication should be clear with
The reason why.
Yeah, no, I think that
the
makes
reason
sense.
why. Yes,
Yeah,
it should be specific to why the request was denied. So if there's something, for example, like a CPR missing or the participant wasn't included on an email, those are
Yeah.
things that are singled out and specifically communicated to that vendor as well as the participant.
Yeah. So what I would note there is if you receive a rejection, and you feel like the reason that was listed is not correct, just place a customer service ticket under accounts payable, and we'll respond to it through the ticket. I would just stress, don't respond back to the processing email, just place a customer service ticket.
Yeah, that's right. At what point should vendors check bill.com for vendor payment?
It does depend on when the invoice has been processed by the team, but payments are in alignment with the AP calendar. So if you review the AP calendar, you submit on X date, it should be in bill.com a few days before the payment date that aligns with the submission date. And I believe the vendor gets an email notification, Anira.
Yes, I was just about to mention that, Peter. If they are connected, they will get an email each time they receive a payment.
Next, are designated representatives allowed to sign on behalf of the participant? Yes, they are. Where can I find a list of DDA-approved camps? Peter, do you have that website? Or just what they can Google to find it?
Yes, I have the link I can drop in chat.
Okay, cool.
I'm not sure if they can see the chat, but it's the American Camp Association website. If you just search that, that'll should be the first result that comes up.
Okay, American Camp Association. Okay. Can the ARC accept invoices with attachments for the required information if the vendor does not put them on the invoice?
I believe that the required information needs to be on the invoice.
Kevin,
Submitted by the
any thoughts
vendor.
there?
If I'm understanding the question correctly.
Sorry about that. I was getting
Yeah.
a link.
Can you
Um,
read that question one more time, Mark? I'm sorry, I'm
Sure.
lost in the chat.
Can the ARC accept invoices with with an attachment for the required information if a vendor does not put them on the invoice?
Can the ARC accept an
Um,
attachment with the requirements if the
Yeah.
vendor does not put them on the invoice? Yeah, so if it's supplemental information, for example, if the invoice itself doesn't have the specific time slots that were worked for the support or the employee names, you could provide maybe like an employee statement for like those days that, satisfies those requirements. I hope that answers the question.
Yeah, that's good.
I would just note as a best practice, it's probably easier for the team if the vendor is ensuring that they're including the required information when they submit an invoice.
Okay, next one's about job development. It says job development funds were previously allowed to be used to pay for job training provided by a vendor. Recently, ARC has denied invoices stating that the vendor must be a DDA provider. This vendor is not a DDA provider, and previous invoices for job training for this vendor have been paid. Has something changed? I think development must be a DDA provider. And here, Kevin, do you see that differently?
No, I agree. I think that's one of the services that are under the provider classification.
Yeah, I
So,
believe
yeah,
it was anything other than OJS and follow along supports.
right. Yep.
Yep.
There are different requirements for a vendor to get paid than for a person to be reimbursed for a purchase. Why can't there be a form specific for reimbursements and dedicated emails for reimbursements? Okay, this is back to that question you'd asked earlier. That way the individual process of reimbursement knows it is a reimbursement.
I think we can take that feedback and we'll discuss it.
Yeah. Looking for other questions here. Don't you need background checks on all vendors and their employee subcontractors? If yes, isn't the birth date on that background check confused with why a valid photo ID is now needed? I don't know about the background check, but we need some sort of proof of age because most services you have to be at least 18 to provide. Any other comments about that one?
I would just say it's a requirement.
Yeah.
Yeah.
What documents are needed for employment services, ongoing job supports for the invoice to be paid out? I think we reviewed that, right? That was ongoing job supports is one of the services that we reviewed. CPR first aid background check, proof of age,
W-9 for the vendor.
W-9, yep. Why has the FMS recently started to deny recreation and parks activities? Socialization and community engagement is a big part of our participant goals. Guess it would depend on what service is being talked about here. Is that an IFDGS? Is it CDS, personal supports?
Yeah.
Should we follow in the
Yeah, I think in
requirements
that
there?
case, you might want to place a ticket.
And I would just say in general, for those types of services, you want to make sure that you not only have the IFDGS request and approval in place from DDA, but also that the participant's budget reflects that specific budget line item that you're trying to be reimbursed for or get paid. We need both of those pieces.
Yeah.
And if one piece is missing, it just gets denied.
Repeating the question about do all support brokers need to be on the participant agreement? If the support broker is providing the service, yes, they need to be on the participant agreement. Support brokers cannot provide other DDA services, correct? Right. They can't. They can be support brokers for other people, obviously, but they can't provide like personal supports and be a support broker as well. It's in the DDA's manual. Is it okay to email vendor compliance to make sure they have everything? Near Kevin.
Yes,
Yes.
I don't see why not. I think that's a quick check for that team. So, yep.
Okay. Under new requirements, the vendor for CDS is filling 30 pages of information now. Okay. I can't process that much in my scanner. Can I send them directly from vendor to vendor compliance, or does the documentation go to FMS vendor?
Not quite clear on what the question was.
Yeah.
I think that might be one where I would recommend placing a customer service ticket, and we can provide some clarification.
It might be that it's taking
Yeah,
a lot of paper to submit the invoice. Okay, it's actually 1:32. There's a whole bunch of more questions here, which we're not going to be able to get to. I guess we can stay on for a couple more minutes to see if there's anything that's different here. Looking for things that are
and
specific.
Mark, I think the question about the multiple attachments, we do encourage just emailing those separate shared mailboxes for compliance and for invoices. Our team works very closely together to confirm that those compliance requirements has been met. So
Mhm.
please do, separate those pieces of information when you're sending those over.
Is there a list of DDA providers that can be used for job development? I would imagine that the DDA's website would have that information. How does a participant request for bill account for a vendor?
They would not. That is initiated once we get the initial invoice request or vendor payment request form. Any email that's associated with the vendor will receive a bill.com invitation. So upon the first invoice submission, that's when the bill.com invitation goes out.
Does a vendor compliance across, I guess it's plan years, or does it need to be reviewed each plan year? I think once you have the information in and it's current documents, we don't need it every plan year. Correct me if I'm wrong there, guys.
That's correct.
Yes, only if it expires.
Right.
Yeah.
Can a vendor submit all documents for all employees at once? I don't see why not.
Yeah.
Does the employee policy need to be submitted with each request for health insurance or only with the first request? Just once. Once we have it, we have it. And then somebody says there isn't a list of providers for job development. DDA is supposed to have a list of you're supposed to be able to look it up based on service, but maybe they don't have that yet.
But you could
Yeah.
always, I would, recommend reaching out to your CCS or even your regional DDA office.
Regional office, yeah, that's good. Okay. That's all the questions we have.
Great. Do we want to give it another minute to see if anyone has any last questions?
Sure. Is Medicare covered under health benefits if health benefits are budgeted on the budget sheet? Reimbursements have been denied, saying only certain parts of Medicare are covered. Is this correct? What
Yes,
parts are covered? Go ahead.
that would be correct. Per DDA guidance, Medicare Parts A and B would not be covered, but Medicare Part C, D, and Medigap can be reimbursed.
Yes, that's correct.
When a vendor hires a new employee, can we send the employee docs over proactively? I think that's okay.
Yes, definitely.
Let me see. Who sends out the 1099 documents? We send those out, correct?
We do.
Yes, they're sent out year end.
Yeah. What's the time frame for the ARC to upload vendor documents or submitted to the compliance email? In here,
Uh,
Kevin.
I don't think we have a calendar in place at the moment. But I think I would be comfortable, and Anira, correct me if I'm wrong, following the accounts payable calendar as far as submission and response. Does that make sense, Anira?
That does make sense.
Okay.
Yep, I agree.
I know a designated rep can sign. I just want to clarify if the legal guardian is able to sign invoices.
Yes, as long as they are listed as the participant's representative as well, because there is a difference between the participant's legal guardian and their designated representative on their self-directed team.
So what if the legal guardian is not the designated representative? Can the guardian still sign?
I
I believe
don't
believe
believe so.
not.
Yeah, it's either participant or authorized representative,
Designated representative, yeah.
designated representative, right?
So if the participant's underage, we're still getting them to sign it? This is a tough question, I know.
I would think in that situation, they would have a representative assigned or in place to be
Well, that's
involved
right.
in
Actually, they're supposed to have a
self-direction.
designated representative.
Yeah.
DDD told us that.
Yeah.
So anybody under 18 should have a designated representative.
Right. That okay. Yeah.
Yep. Are support brokers supposed to provide their IDs and CPR certifications? I think that's a yes.
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 Yep. Is dental or vision covered under healthcare for healthcare reimbursement?
Yes. Medical, dental, and vision premiums are covered for health reimbursements.
With the new participant agreement on page 5, can the individuals listed submit a ticket without adding the participant email? They would have to list that person as being someone that can contact us without them being involved. Okay, I'm trying to read this one. I'll just read it out loud. For BSS invoices, when we list every DSP present, is that only applicable to the BSS providers, employees, or all participant employees since they directly employ staff for community development?
When we're referring to specific invoices, we would only need to list the employees that provided support for that particular participant, not every employee that works for that provider. I think that answers the question.
How often do vendors need to do background checks? Once? Is it annually? I think it's just once, right?
Yes,
yeah.
annually, right?
Yeah.
Once a year.
I believe it's annual, yeah.
Oh, is it annual?
Yeah.
Okay. These are good questions. Is life insurance reimbursement covered under benefits?
No.
No.
Mm,
Okay. All right, Peter, I think we're good.
Great. So thank you for all the excellent questions. Again, we will be posting both the webinar and the presentation on the forms and resources page of our website under webinars in the next couple of days. So if somebody missed it, they can always circle back to our website to view it. And as ever, if you have additional questions, you feel free to place a customer service ticket or give us a call at our stakeholder relations line. Thanks so much for attending today.
Thank you.
And thank you, Anira, Kevin, and Mark.
Yep, thanks.
Definitely. Thank you.